My name is Professor Sjoerd Repping. I'm one of the board members of the consortium, and I'm also a professor at the Academic Medical Center in Amsterdam. So what we do is that we already know that half of all medical treatments are of unknown effectiveness. What we've developed over the years is a truly unique feature where we're able to continuously evaluate medical interventions and to see what's best in terms of costs, effectiveness and burden for patients. So one would say if we know that half of all medical treatments are of unknown effectiveness, that everybody should be doing this. Well, that might be the case, but we've demonstrated over the past 10 years that we're able to do this in a very efficient and a collective way by doing multi-center randomized controlled trials and truly demonstrating that by doing these studies we've increased healthcare in the Netherlands. So one good example is IVF treatment. We know IVF works very well for women with closed fallopian tubes and men with no sperm cells, but does it work for older women that have no causative reason for infertility? So what we'll be doing in the next few years is randomizing patients between IVF and expectant management, hopefully to demonstrate that expectant management is just as efficient, but of course much more safe and much more cheap.
When a woman is pregnant, she is in the antenatal clinics either with a midwife or a gynecologist. And basically what we do is we ask her for complaints if she feels the baby kicking, and we measure her blood pressure and measure the growth of the uterus to see if there's a normal fetal growth development. In case we have seen in hypertension, sometimes with complaints, and a proteinuria, then she's diagnosed as preeclampsia, which can be a severe disorder. The only optional and rational treatment for her is to deliver the baby. But we don't know if deliver the baby is the best management option or to have expectant management. But since we started the consortium studies in 2003, we managed to find an answer for these questions. We know that induction of labor is for a better outcome for the mother and her child. It's not only for her medical outcome, but it also reduces cost, reduces hospitality rates and admission for mother and child to the intensive care.
70% of the Dutch hospitals participate in our projects because Dutch gynecologists see the importance of evaluating care for their patients.
The whole reason for this consortium to exist is to have healthy mothers who can take care of our next generation, which is the most important issue in society.
So we believe deep-heartedly if we gather proper evidence, then we can really help patients and doctors to decide whether or not they should be undergoing treatment. Well, the goal of our participation is actually to spread our knowledge and to spread our example to other medical specialties in the field so that future patients in any type of medical field will be offered the best treatment they can get.